Since the start of violence in Rakhine State, over 582,140 people have fled Myanmar and arrived in Cox's Bazar, southern Bangladesh, according to the estimate of the Inter-Sector Coordination Group, ISCG, hosted by the UN's Migration Agency, IOM. Numbers spiked again in the past week, when over 18,000 Rohingya crossed into Bangladesh, fleeing what has been described as ethnic cleansing. The speed and scale of the influx has resulted in a critical humanitarian emergency. The people who have arrived in Bangladesh came with very few possessions. They have used the majority of their savings on transportation and constructing a shelter, often out of no more than bamboo and thin plastic. They are now reliant on humanitarian assistance for food and other life-saving needs. Basic services that were available before the influx are under severe strain due to the massive increase in people in the area. In some of the sites that have spontaneously emerged, there is no access to water and sanitation facilities, raising the risks of an outbreak of disease. The Rohingya population in Cox's Bazar is highly vulnerable, having fled conflict and experienced severe trauma, and now living in extremely difficult conditions. IOM is working closely with WHO to coordinate health response planning. A revised emergency health sector response plan for the next 6 months has been created to address short and medium-term plans for addressing the acute health needs of the population. IOM continues responding to the influx with coordination in programmatic efforts, including expansion of existing health services, provision of new services, mobile medical teams, and has been providing services including emergency health, primary and secondary health care, sexual and reproductive health, maternal and child health, mental health and psychosocial support, as well as referral services. Despite efforts, current responses are insufficient and need to be scaled up to save lives and improve health of children, women, and men affected by this crisis. Needs. All new arrivals require health assistance. Crowded living conditions with lack of adequate water and sanitation, wash, continue to present significant risks of communicable disease outbreak. All new settlements need scale-up of healthcare services, including mobile services to assess those in hard-to-reach areas. Healthcare services implemented at settlement level lack standardization, quality of care needs to be reinforced. Insufficient accessibility to inpatient and secondary health facilities, including referral system. Need to reinforce existing hospitals and additional inpatient service delivery. Insufficient services in essential reproductive health as well as maternal, child and newborn health services, especially in hard-to-reach areas. Insufficient clinical management of rape survivors, family planning as well as adolescent-friendly health services. Need for scaling up and standardization of the community health workers, CHWs, network to ensure adequate health and hygiene promotion, as well as continuum of care.